The next speaker is Professor Wei-Ti Chen from UCLA, the United States.
Okay, so it's my topic to talk about focuses in United States and in Taiwan. In fact, it's quite interesting to talk about United States. Up to yesterday, there are 2.23 million of COVID-19 cases confirmed in the United States. And finally, we achieved to the make the America great again. So now we are the #1 other country of the whole world. So we are close to the 120,000 deaths according to the world meters. And meanwhile, the deaths related to COVID-19 is slowly decreased currently. So, you know that in New York City is one of the highest and the epicenters is in the United States. Currently, meaning that up to 400,000 workers on June 8th could return back to the job. So it's slowly opened up in New York City in the phase 1. And retailer store will reopen just a curbside or in-store pickup. So you can see people in New York City taking subways, or not everybody wear mask. The city testing nearly about 33,000 individuals a day for COVID-19. However, the mayor still complained it's not enough for the testing every day. New daily cases are down about 500, but it's still halfway a week ago. So it's still kind of like going up. So reopening the United States, that as the President Trump asking that whether the country still need to be in lockdown, or he preferred to open up the country as soon as possible. So that is why the countries are slowly opening up. That you can see the Times Square, there is nobody there during the lockdown phases, and so at least all 51 states of the United States are partially open. New Jersey has done limited reopening, and but soon, a couple of days ago, they start open up the first phase. And so cities need to release the guideline how to open it up. So various part of society, some school, childcare center, restaurant, and public transport can start running. However, even though the school is opened up, most of the parents are not feeling comfortable to send their kids back to school, which means that in summer camp, all the summer camps mostly are canceled. So either the summer camps still using the Zoom summer camp, or really lock the kids inside the houses, or all going at the same time. So they also offer the recommendation for official open, including no public station or no coffee pots or water in the office. So which means that even the office is open, you should not share the coffee pot with the rest of your cohort or rest of your colleagues. You need to bring your own lunchbox, but there's no sharing. So that is why that all the brand names office like Airbnb, Apple, and Google offices are all closed, and then they already have announced that all the employee can work from home forever. So there's no end day for work from home order. That means that it will also make the whole United States economics shifting a lot, which means that they don't need to constantly living in New York City, living in San Francisco or San Jose or Silicon Valley. They can live in out of remote like Colorado or Idaho, where as long as they have Wi-Fi, they can work on site. So that is the current situation, that the whole economic in the United States will be changing. So there are some rising states that so far today, there are so many states, including California, Florida, and Hawaii, cases are raising. So the state governors are still pushing to reopen, even the cases are booming up. So there are some flat increasing, like Washington State, Seattle, where is the first case that we reported in the United States. And then New York City and New Jersey are slowly going down, but not New York City. So you can see those photos, even though state reopened, especially in California, those famous beaches, people are still going, and it's very, very packed, and that it's very, very hard to find a parking space. Rarely people wear masks. Think about if they are wearing bikinis, why they still need to cover their mouths. So for those at least partially reopened, like Delaware, Illinois, Michigan and Jersey are slowly opening. And California store opened about a month ago, but schools and especially university that you can you hear that University of California and California State University, those two big state system university already announced that there's no in-person school until the end of the year. So which means that all the lectures and courses will be delivered online. And for reopening business in California, that they need to virus screening for all employees, which means that if they are running for a restaurant, everybody inside the restaurant need to have a virus screening regularly, like every 2 months, every 2 weeks to do the PCR and disinfectant protocol and social distancing guideline. So which means that usually the table inside a restaurant need to have 2 feet away before they can really open up the restaurant. So guideline for reopening, for example, social distancing is like 6 feet between each desk and desk facing in the same direction. For example, inside the school, if kids want to go back to school, they can only facing the same direction. And lunches within the classroom, there's no more cafeteria going, and scheduling time of arrival of the student, they cannot really show up at the same time. All mask up for staff and teachers and even students. Think about that. If university students have hard time to cover them or make social distancing, how can we sure that elementary school or middle school or high school student can keep the social distance? So there will be also debating whether the elementary school or the K-12 system need to be open. So on buses, they are encouraged, the CDC recommends sitting students in every other row. And at the same time, especially in public transportation, they need to make sure that not every row can be seated. So that is a good news for New York City and Los Angeles, because there are rarely people going out, and then there are no more last transportation pressures. Is that when you can get out, that you can definitely find seats. So close communal use of space such as dining hall and playground is possible. So far, the playground still closed, and the state haven't opened up yet for the playground. So kids still mostly remain inside the school. So all the places need to be disinfected. Compared to Taiwan, it's quite interesting that you can see the photo that this is the current photo after COVID-19. All the kids still eating the cafeteria food, but delivered to their desk, and everybody has their own cubits while they open up their mouths, not covering their mouth. So a little bit of history about Taiwan. Back in 2003, there is a SARS pandemic hit Taiwan very, very hard. The government took the shift and early action while the SARS came, the COVID-19 came from last year, about December 31st. The Taiwan Central CDC got a news from Wuhan, China, that there are some unknown pneumonia. The government started having the task force, and mid-February, Taiwan increased its mask and alcohol sanitizing production. So at that time, that there's no longer able to export mask outside of Taiwan island. And so there are alcohol sanitizer has mass productions, and all the people in Taiwan need to be protected before they can export all the equipment outside of country. And so for those people who raising the price for medical supply get fined, and set up the cleaning standard for public transportation and other area, including trains and schools. So for spring semester, all the students inside Taiwan Islands are delayed for 2 weeks to open up the school. After February 15, 20, after February 20th, all the students go back to school, start the same semester. So still, there's no lockdown, so the school's still going as usual. As of today, there are only 446 confirmed cases and 7 deaths in Taiwan. So the early action has been, as Taiwan is not part of WHO, so Taiwan does not have the official information from WHO. So it's quite interesting because Taiwan's government are really independently deciding the situation. So when they banned the whole lockdown the country, it has been criticized from all over the world that how come the Taiwan can act early. It's quite interesting that the country public health institute designate to be sensitive in this kind of cases, that and so in very, very early stage that people in Taiwan start wearing masks. So you can see the photo. This is quite early. It's around like February or March at that time. Everybody on the streets still wearing very heavy jackets, wearing masks at that time. So the result speaks for itself that the government in the Taiwan CDC, Central CDC already government that implemented the prevention early. So what Bill Gates have been saying recently is that I don't think the country has a perfect record, but Taiwan comes close. So because this is so close to China, it's about like 80 miles, it's only 7 deaths from the disease up to date. So because of the past history, the Taiwan set up the interlocking set of agency and very, very strict contact tracing for tracing every potential exposure for those COVID-19 cases. So if the threat is detected, contaminate plants and supplies stock up already. So the process starts from the bottom up, but not from top. So it's really from every community and every districts of the community to start following those contact tracing. So the home quarantine penalty from non-compliance, you might ask why people want to do that, because they are fine. If there are isolation regulation, means that the people have confirmed contact with COVID-19, the fine is higher. But for people who are quarantine, regulations is much lesser, like from 33,000 to 3,300 to like 33,000 if they are really in extremes that they cannot really stay home for quarantine. But for isolation, that as long as the people who knows that if a member who confirmed with COVID-19, they need to be isolated. So that means that for 2 weeks, for 14 days, and there is an app tracking down on the dates. So how can they track down? They including videotaping, photo information for those people who really not following the regulation. So the one reason sample is that there is one musician came from Australia, who came from British Columbia and then stopped by Taiwan for 5 days for performance and then left home to Australia. And after he arrived in Australia, he was confirmed COVID. So that contact tracings come back to Taiwan, that everybody tracing that who picked him up on the airport and then who attend the performance in the auditorium, the musician performed with him, are all need to be isolated inside the house for 14 days. During these 14 days, the community person in charge of the community will track down the person every day for 14 days. Make sure the person who isolated or quarantined inside the house, no, not staying with anybody older than 65 years old, or inside the house there is no younger kids younger than 6 years old. So the person need to have one private bathroom in order to stay inside the house. If not, they are welcome to stay in the quarantine hotel or some governmental supported quarantine spaces. That is also possible. So what kinds of improvement they have been made based on the past experience? So in Taiwan government provide one of the two press release every day. So all the reporter can show up and answer question. The person in charge is the governmental official who is in charge of the all health care issues in Taiwan. This is Dr. Chen who is the dentist, that background, answering the whole system for every day. Even now, they still have every day 2 o'clock in the afternoon news regarding what is the current COVID stage and what kind of question that they have answers. So people have issues, they can show up. Also, the government also explored the prime time slot for television channel for public education purpose. So all the mass media that you can see and show that what kind of protection and prevention strategy should be used are all showed up in Taiwan's mass media. So the rule of technology is quite interesting. In the beginnings of the stage that everybody need to wait in front of the pharmacy to purchase their mask. So the mobile phone has positioned the technology to show up which locations still have masks available. So people can go to the pharmacy who's still available with mask that you can pick it up. And especially big data analysis of assuring that tools of identifications of suspected cases and location make marks are still available. For example, at that time, the Diamond cruise ships stopped by Keelung in Taiwan, in northern Taiwan, in the end of January. So whoever confirmed cases with COVID-19 positive has been reported to the government. So the government can draw up a photo on the cell phone in a Google Map to show people at that specific day or at specific time showed up in that places should stay home for 14 days quarantine. If they have any illness or symptoms showed up, they should show up in the hospital in front and for testing as soon as possible. So at that time that it take about 14 days to know who got infected, who might be infected. Luckily, there's no reported from those Diamond cruise ships for that trip. So that is how they use the technology to enhance the whole system. So currently, they can purchase the mask or all the supplies in all the stop by 7-Eleven or the 24 hours convenience store and online order. So the epidemic causes public panic. And how about Taiwan? In fact, you won't see that people are causing a lot of panic in Taiwan. I believe that because of the mass media and then the low cases in Taiwan, Taiwanese are not as panicked as people that we see compared to the United States. People are not also panicked because they are also think that this is the hoax of the Trump government. So that is why you see people who are not afraid of the COVID-19 still partying in at beaches or participate in the recent Black Lives Matters protests. So you can see that. So escalating epidemic response to the level of national security. So they are make sure that they're strengthening epidemiological surveillance and prompt responses and implement border control. So currently there's no transfer flights in Taiwan Islands, and then we still have 5 direct flights from China still, and then there are limited flight from United States back to Taiwan. There are still direct flight back to Taiwan. Only people who hold the Taiwanese passport can come back, but they are not accepting any foreigner to come into the island. And also strengthening medical preparedness. So far the hospital systems are still well prepared and waiting for the next wave to hit, but so far everyone is still living as usual. So enhancing the risk communication awareness promotion. So there is a free phone line that you can always call that a real person will pick up the phone. You don't need to transfer for so many times until you can talk to a person. So the system is still in place. So far that the system is still working so far. So that is my report. Any question, then you can contact me or email me.
Thank you very much. Thank you very much, Wei-Ti. It is very comprehensive, and it covers a lot of the detail in 2 countries, the United States and the Taiwan, in a very timely presentation. Thank you very much, and we keep a note in. Please keep your question. After this session, we will ask the question to Wei-Ti.